Hey there, welcome to the next episode of Raising the Bar Live, where we talk about all things benefits. I know we usually stay out of the weeds. We talk just about a couple of specific examples, usually client facing. But today we're going to talk about direct contracting. And let me tell you why that's important. The CAA has some interesting requirements about eliminating gag clauses and a whole host of obfuscation that happens between a hospital system and a health insurer. I'm sure if you've ever tried to collect data, understand what you're paying for care, you've gotten some version of, well, that's proprietary. We're not going to share it with you. That is no longer possible. So I think that you're going to see a lot of change in how claims, particularly large claims, are paid and shopped for, because yes, you can shop for healthcare like you shop for anything else. It's taken us a bit to get here, but we're getting there. So let's talk about direct contracts. Direct contracts are when you arrange to pay a facility a set fee for a specific procedure or a group of procedures, so that if you have an employee who needs a knee replacement, a back surgery, their gallbladder out, whatever, obviously not emergent kind of things, but you have a fixed price for that. There is a benefit not just to you, but there is a benefit to the provider for that as well. In those arrangements, typically, we have agreed to a service is covered at X cost, whatever X cost is, and the facility is paid quickly. Typically, they're not even paid on a claim. They're paid on an invoice because the pre-auth takes care of the pricing agreement. And when you do that, you can help your member. Typically, the employer is saving so much money that they can afford to cover that procedure at 100% rather than deductible and 80% or whatever it is that your plan regulations are, the rules of the road are for your plan. And I've seen this work really well, and I have seen this work not so well. So today I'm going to give you 10 questions to ask if you are talking about a direct contract. Now, unless you are a very large employer, I'm going to say that you should not be negotiating direct contracts on your own. Your TPA should be doing that for you, and your TPA may have a host of direct contracts that they have already negotiated, or they might partner with a company that has negotiated direct contracts, and then they take a small fee built into the price of the service for accessing their contract. So let's talk about what to look for. So what providers and services are included in the contract? There is a reason that there is this balance bill negotiation and an out-of-network Fair Payer Act business going on, because if I'm unconscious and I'm having my knee replaced, I really can't say who's looking at my x-ray or who's doing my anesthesiology, and that can really harm somebody. So when you are negotiating a direct contract, or when somebody is presenting you with a direct contract, what's excluded, right? What's included in the contract? Are there any services that are not covered under the contract? And if so, are they things that there is a negotiated fee for? And let me give you an example. I need my knee replaced. I use knees a lot. They're a good example, and lots of people have knees that need to be replaced. Let's say that I have negotiated, I go to X facility for knee replacements. The surgeon is great. The staff is great. Anesthesiologist on staff, on board, all pricing great. Normally that procedure requires 2 screws, and I am making this up. So if you're an orthopedic surgeon and I'm wrong, I'm wrong. Needs 2 surgeries, needs 2 screws. But if something happens and there needs to be 4, is the price of those screws negotiated? Okay. And do you need 4 because they fell on the ground, or do you need 4 because there's a different kind of apparatus being used? Those are 2 very different questions. 3, how will the cost be determined? Sometimes it's a multiple of Medicare. Sometimes it's a cost plus basis. It doesn't really matter as long as you think it's a fair price. Are there any financial incentives or penalties built into the contract to encourage high quality, cost-effective care? I'm not really a big fan of building penalties into a contract. The contract should already include any complications that they need to be covered under the price of the contract. What I am a big fan of is ensuring ahead of time that the member is seeing a high quality provider. And I know that's a very controversial subject, but there are ways to do it fairly. It doesn't take 5 minutes. Sometimes it takes 2 or 3 days, but that is the best way to determine outcome. High quality provider, high quality outcome, almost always. Will the participating in the direct contract affect my ability to see other providers or access other services? It shouldn't. Everything you need for the surgery or the procedure should be included in the contract, but anything that happens outside of the scope of that contract, that's a separate provider, separate relationship, all that kind of stuff. How will my care be coordinated with other providers? This is a big one. It's very important. First off, it's very important to have a primary care physician. Okay. And most people don't have one. A primary care physician will help you manage your life, right? Are you eating? Are you sleeping? Your blood pressure is elevated. Let's talk about why. Do we need to put you on medication? Can we moderate this with exercise and diet? Take care of a lot of the little things that happen and prevent bigger things from happening. So I am a firm believer in that for everybody. If it's virtual, if it's in person, if it's whatever it is, but a relationship with a direct primary care physician who understands you and your person, because every person's a little bit unique. So yes, you should coordinate that with your primary care. If you're having a knee surgery, you're having a back surgery, you're having some other kind of procedure, all of that your primary care should be aware of that. If you do not have a primary care, you do not have a primary care, and that is okay. What is the process for resolving disputes and appealing coverage decisions? This really shouldn't apply because either the contract is used or it's not used. So the pre-auth, determining medical necessity, you should be determining medical necessity on evidence-based medical guidelines, will determine if it should be a covered procedure or not. Okay, fine, it's a covered procedure. The direct contract takes place and it's done. The surgery is done, the provider is paid, and everybody moves on to a happy outcome. Okay, it really is ridiculously simple. How will the contract be evaluated and potentially modified over time? There will be times when pricing will change in a direct contract, but it shouldn't be every month. It should be a little less frequently, and you have to agree to the direct contract for each procedure. And let me back up and say the TPA. So that's really not in the employer's domain, and that should happen on the back end and outside of your office. How will this affect my premium or cost sharing on the insurance plan? Excuse me, damn skippy, it should. Let me give you an example. I have a client who had a member have back surgery about 2 years ago now. And the billed charges for this surgery were about $80,000. The PPO discount ended up at about $36,000. We found a direct contract for it for $11,500. Nowhere in there was somebody not getting paid. Everybody was getting paid. And the thing about direct contracts is that the facility agrees to the direct contract. Nobody's making them do it. It is agreed to ahead of time. So everybody knows what's happening. Okay, so there's nothing, there's no RBP, there's no balance billing, there's nothing. There's a direct contract. The patient comes in, they say, okay, here's my certificate for my procedure. Paper, please, no paper. App, here's my QR code gets scanned, and off you go. That is how this should be. So it affects the employees out of pocket cost in a really positive way. And it affects the employer's total cost for care. And you know that we believe that employers should pay a fair price for healthcare and for as much healthcare as their employees consume, but really as much as they consume and not anything extra. So this is a way to help accomplish that. And finally, how will the contract impact my existing coverage of benefits? Well, if you are an employer and you are creating a health plan, you can build direct contracts into your program. This is easier and simpler than simply using RBP. It's a little easier for the facility because they know what they're getting paid up front and they're agreeing to it.